Hello everyone. I would like to talk to you today about the extraordinary times we find ourselves in. We are in an evolving phase of what is going to be the most significant global pandemic that we have dealt with for over a century. Not since 1918, when a novel influenza virus spread across the globe with devastating consequences, have we dealt with a novel virus that has spread so fast and so widely and with such consequence. As in the past with other public health crises, we at UCSF are standing up to provide leadership, innovation, and hope for our community, for the state, for the nation, and the world. So what do I see at UCSF? I see our students, our learners, and our educators immediately pivot to remote learning, a whole new way of keeping the momentum of our education moving forward. I see our students mounting donation campaigns to bring in more personal protective equipment to keep our frontline health workers safe. I see our staff asking what they can do to support our efforts to keep patients well, safe, and on the road to recovery. I see our donor community rallying together, asking what they can do to help UCSF drive forward during these challenging times. I see our brilliant research community immediately dropping their important research work to pivot and deal with the coronavirus. Whether it's a group of faculty standing up a brand new certified diagnostic lab in under a week to amplify our testing capacity by 10 or 20-fold. More than 100 graduate students have volunteered to work in that diagnostic lab around the clock so that we can bring diagnostic tests to the community. Others of our researchers have immediately started to focus on how does the virus interact with the human lung cells. Can we find new targets, drugs that may already be approved, that can be put into use during the time frame of this pandemic? Our engineers are hacking solutions that help our frontline workers remain safe. Most importantly, I see the courage, the dedication, and the determination of our frontline healthcare workers, our physicians, our nurses, our respiratory therapists, and many, many other frontline healthcare workers who know that they are at some level of risk, but nevertheless are dedicated to give the very highest quality of care to patients who have this novel virus. Let me now turn to CEO Mark Larrett to talk a little bit more about the UCSF Health response.
Moments like these are when UCSF Health stands up for the welfare of our patients, our communities, the nation, and the world. UCSF Health is being looked up to for leadership in this pandemic. Our community expects and needs us to show the way forward. The ramp-up of patients with coronavirus is inevitable, and when that happens in full force, we must be ready. Our priority continues to be the safety of our faculty, staff, learners, and patients. To that end, we have restricted visitors to our clinical facilities and are screening all healthcare workers and necessary visitors. I also want to remind every UCSF Health team member, clinicians, and staff that you are essential to our ability to fight this pandemic and to save lives of those who count on us. I know that many of you already are taking on extra duties or work you typically don't do, and for that, I thank you. I understand the personal stresses on each of you and your families are great, but I also hope that you will commit to joining the rest of the UCSF Health team in serving on the front line of this battle against COVID-19. The next 1 to 3 months are almost certainly going to be a challenge like we have never faced before. But this is a challenge we can and must take head on with confidence and commitment. On behalf of the entire UCSF Health leadership, please accept my profound gratitude for all that you are doing for UCSF Health and the patients we are privileged to serve.
On behalf of the UCSF Deans, Michael Reddy, Dentistry, Liz Watkins, Graduate Division, Catherine Gillis, Nursing, and Joe Guglielmo, Pharmacy, we want to acknowledge the important role that all of you are playing to address the COVID-19 pandemic, whether it is directly treating patients or helping ensure our colleagues and learners have the information and tools they need to continue advancing our critical clinical care, education, research, and public service missions. Now, more than ever, UCSF's professional schools and the Graduate Division take pride in our ability to prepare a generation of healthcare providers and scientists to treat the most vulnerable populations and strive to solve the Bay Area, state, and nation's most urgent health problems. We know the current COVID-19 pandemic is putting unprecedented stress on our systems and our people, and we are extremely grateful for your professionalism, commitment, and service. Given the collaborative culture at UCSF, we know working at a physical distance from your colleagues may induce feelings of anxiety and isolation. But we must support actions that help to flatten the curve of new COVID-19 cases, thereby creating fewer opportunities for community transmission. Thank you for all you have done and continue to do to advance the health and well-being of the communities we serve.
In closing, I would like to make just 3 points. First, it is impossible to know, as I sit here with you today, where this pandemic is going. We must prepare for the worst and hope for the best. It is likely that things will get worse before they get better. However, I am reassured by the public health decisions, the courageous public health decisions that have been made by Mayor London Breed and the Governor of the state to impose the kind of public health policies that are absolutely necessary if we are to get out ahead of this pandemic. I am also reassured and confident that everyone at UCSF has done their part to make UCSF prepared for whatever comes, to care for our patients, to care for ourselves, and to provide the kind of leadership that we have in the past, to give everyone confidence and hope that we will get through this together. Thirdly, I would like to thank all of you who have just stepped up in a truly remarkable way. Whether it's the people that keep our facilities clean, people that make sure our supply lines are open, people who have on the fly developed cutting-edge clinical pathways for patients with coronavirus, whether it's the people in our command centers who are spending 24/7 coordinating our response, and of course, a special thank you to those on the front line who are caring for our patients every day. Finally, as I thank you all again for what you are doing, let's remember that this virus is agnostic to race, ethnicity, socioeconomic class. There is absolutely no room for discrimination of any kind as we come together to fight this global scourge. Take care of yourself. This is a marathon, not a sprint. Take care of your family, your friends, and your community.